women in India have always found treatment by male physicians unwelcome. There is a lot of embarrassment, and in certain communities, the ladies are so orthodox that they have preferred to die rather than have a male doctor examine them. As a consequence, there has been untold suffering, and the consequences in terms of death for quite a few patients, because male physicians and male surgeons could not be requested to examine them or treat them. From the 19th century, almost the mid or late 19th century onwards, there was a growing consciousness amongst educated and committed women of the need to help their ill sisters. So many of these young ladies sought admission to medical colleges, not only in India, but also elsewhere, in America, in Britain, and other countries. But their attempts were frustrated because male physicians felt that medicine was not a good profession for ladies. It would be too strenuous, and also it would interfere with their primary task of looking after their families. Administrators and teachers in medical colleges also derided these attempts. The 8 ladies that you see on this slide are ladies who defied tradition, who became medical doctors, and who eventually served their countrywomen with distinction. Now, here is an example of the prejudice that these young ladies faced when they tried to get themselves admitted to medical colleges. And in the very prestigious British Medical Journal in 1862, there was this statement, which of course the young ladies of today would bridle at. But there were individuals like Sophia Jex-Blake, of whom we will talk a little bit later. And they insisted that they had to have a fair field, and they also insisted that they did not need any favor from their male teachers, administrators, or colleagues. Now, Sophia Jex-Blake was one of the pioneering young ladies who got admission to medical colleges. And eventually, these 3 ladies, Anderson, Blackwell, and Jex-Blake, set up the London School of Medicine for Women, which was the first medical school for women in Britain. Let's turn to India. And in India, I think all of us know of the endeavors of Anandibai Joshi. And I've summarized a little bit about her life and career on this slide. Since there was no medical education available for her in India, her husband coaxed her, guided her, advised her, and made it possible for her to go to Pennsylvania, where she graduated. And when she graduated, Queen Victoria sent her a congratulatory message because she had pointed out that after having graduated in medicine, she wished to come back to India and look after her fellow countrymen. Unfortunately, after returning to India in 1886, although she was appointed as physician in charge in Kolhapur, she succumbed to tuberculosis just a month before her 22nd birthday. And so she was never able to fulfill her ambition.
Michigan's governor has declared a state of emergency.
Now, women tried to, in Western India, and that's the part that we are interested in because we are talking about medical doctors in Bombay. Women tried to get admission to the Grand Medical College, which was the only medical college in the city, in the presidency of Bombay at that time. It was founded in 1845. And there were 2 business individuals, Sorabji Shapurji Bengali and George Kittredge. And they were in the forefront of forming what they eventually called the Medical Women for India Fund. And this, of course, was about 40 years after the Grand Medical College had been founded. Now, they were inspired by a lady called Dr. Elizabeth Hogan. And Dr. Hogan was the first Welsh woman to become a doctor. And she had published an essay in 1882, which argued very, very interestingly, because it was a very far-sighted argument. It argued for a medical service in India managed by women. So this fund, which had been founded by Kittredge and his colleague, applied to the University of Bombay and to the Grand Medical College for admitting women to this college, but they stressed that they wanted no favors. They stressed that there should be parity of education and there should be parity of qualification for male and female graduates. Fortunately for them, at the helm of the Grand Medical College at that time was a very far-sighted individual, Dr. Henry Van Dyke Carter. Dr. Van Dyke Carter is also reputed for his researches in tropical diseases, especially in leprosy. And Van Dyke Carter supported the fund's application, and as a result of which, women were admitted to the Grand Medical College. Now, an index of the success of the endeavors of these two male businessmen and Dr. Van Dyke Carter is seen in a statement made by Dr. Jerusha Jhirad, of whom we will talk a little later, in 1957. And she stated that in India, women were admitted to the course and the degree in medicine through the efforts of men who realized their need for their suffering sisters. And she also pointed out that compared to the struggles in the West, women in India had smooth sailing because of the ground which was prepared by philanthropists and social reformers. In the West, in medical colleges, the early women medical students were heckled, they were sidelined, they were ridiculed by their male students. Fortunately, this did not happen in Bombay and in India. One of the pioneers, as far as the medical education of women in India was concerned, and more especially Bombay, was Dr. Edith Peashee. And after coming to Bombay, she married a businessman named Mr. Phipson, so she became Edith Peashee Phipson. And she had graduated from Edinburgh in 1877. And Mr. Kittredge happened to meet her in Paris, and he invited her to join the Kama Hospital for Women, which was at that time under construction. So Dr. Peashee arrived in Bombay in December 1883. And in 1886, there was an epoch-making event. She was appointed the first senior medical officer in the first hospital in the world to be staffed entirely by women. And this is a point which was emphasized by Mrs. Edith Luchker, who was a medical historian, very keenly interested in the history of medicine in Bombay. She's written a book on Dr. Edith Peashee, and she also did a lot to make people aware, not only in Bombay and in India, but all over the world, of the contributions of Dr. Waldemar Haften. So Mrs. Edith Luchker was a remarkable medical historian, very keenly interested in the history of women in Bombay. Now, it was Dr. Peashee who enabled Rakhmabai, of whom we will discuss a little later, to attend the London School of Medicine for Women. And she could do that because she was on very good terms with this London school. In fact, she had delivered the inaugural address at that school in 1877. Now, the first woman to graduate from the Grand Medical College was Dr. Annie Walk. She obtained her LMNS, which was the prevalent medical qualification of the University of Bombay at that time. There was no MBBS. MBBS came much later. And I've given a little bit of her life story on this slide. She graduated in 1888, and she was a brilliant student all throughout. And competing with the male students, she won the Queen's Gold Medal. Well, the Queen's Gold Medal was actually meant for women, but she also won other scholarships and the Lady Ray Gold Medal. She was a brilliant student of the Grand Medical College. And she completed a residency at the Kama Hospital for Women and Children and was later appointed the second physician at the hospital. There was the second physician and then there was the first physician. There were two physicians, consultants at that hospital. When Dr. Pishi returned to England, she served as the first physician of the Kama Hospital. That means the senior most physician at that hospital for 2 years. In 1895, she traveled to Brussels, where she obtained her doctorate, the MD degree. And on her return to Bombay, she continued to work at Kama Hospital, but she also had private practice, where she had a large clientele, which included such individuals as the Maharani of Baroda and the Begums of the Nizam of Hyderabad. In 1901, the Times of India reported the sad news that she had died aged 35 years. We do not know the exact cause of her death. The plague was raging in Bombay at that time, so there is a conjecture that she may have died of plague. But the brief description that we have of her clinical course of the last illness leaves us a little bit doubtful, because there is no mention of any of the classic symptoms or signs of plague. We tried to find her death certificate in the archives of the Municipal Corporation of Bombay, but we failed to do so. And I have also been unable to find a single portrait of this remarkable lady. But any one of us can pay homage to her by visiting the cemetery at Sivri. Unfortunately, her grave is in a sad shape, as you see on the picture on the right bottom of this slide. And if you ask the person in charge of the cemetery, he will show you the register. And on that register, you can see the date and on which she was brought, her body was brought to the cemetery for burial. You can't really read the inscription at the top of the slabs which are kept on her grave, but they say that she was the beloved wife of Arthur Robert Shaw. And she was born in 1865 and died in 1901. The first women doctor from the Grand Medical College in Bombay. We had spoken a little bit about Rakhmabai earlier, and here is her story. At that time, child marriage was prevalent, and Rakhmabai's mother had been married at the age of 14. She gave birth to Rakhmabai at 15, and at 17, she was a widow. And that was not an unusual story for that period. So at the age of 24, she married a widower, Dr. Sakaram Arjun. Dr. Sakaram Arjun was also a graduate of the Grand Medical College, and he was a very broad-minded individual. Marrying a widow was not commonplace at that time, but he went ahead and fought tradition to marry Rakhmabai's mother. Now, Rakhmabai was married off by her mother at the age of 11 to a person called Dadaji Bikaji, who was aged 19. Now, this was not acceptable to Rakhmabai. And so there was a celebrated series of events where she fought to dissolve the marriage. And she succeeded. But in the process, she had accolades and she also had brickbats. Dr. Edith Pishi Phipson, as we mentioned earlier, helped her to gain admission at the London School, And then later she worked at the Rotunda Hospital in Dublin. Now, obviously, she did very well when she was in England because she was befriended by Tennyson, Prime Minister Gladstone, and the first wife of Bertrand Russell. So she must have been a very, very approachable and very friendly individual who evoked admiration in many others. And on her return, she served in Kama Hospital, and later, at the request of individuals in Baroda, Surat, and finally Rajkot, who desperately needed a woman doctor, she moved to these places and set up clinics where women could be treated. Now, her work during the plague and influenza epidemics her work was so admired that she was eventually awarded the Kaiser-i-Hind Medal. Dr. Rakhmabai often called the young Dr. Jhirad, who was in Bombay at that time, to come and observe and study exceptional cases under Rakhmabai's care in Surat. So in that sense, she tried to help young and budding doctors to gain experience, see unusual patients, and learn from them. Now, the hospital in which she worked in Surat was called the Rakhmabai Hospital, but it has fallen upon very, very sad times. This is Rakhmabai's hospital. And you can see that the name of Rakhmabai is in very, very small letters. You have to search for it. And I have marked it out with a yellow bold arrow on the bottom left-hand corner of this slide. The hospital should actually have Rakhmabai's name in bold, big letters, instead of which it is called the SMV Hospital. And it's a sign of the times that SMV is a medical store in Surat. And this hospital is now being named after a medical store instead of the pioneer doctor who has set it up. We now come to Manak Bahadurji. Manak was the daughter of another graduate of the Grand Medical College. Atmaram Pandurang was a member of the first batch of medical students at the Grand Medical College. And Manak graduated as LMNS from the Grand Medical College in 1895. And just as we saw with Annie Walk, she too had a brilliant undergraduate career, and she won several prizes, and I've named just two of them, the Moorhead Prize and the Lady Ray Medal. Lady Ray, of course, was the wife of the governor. Moorhead was the founder of the first principal of the Grand Medical College. Then she went to Scotland, and there she got these three qualifications: Licentiate of the Royal College of Physicians of Edinburgh, Licentiate of the Royal College of Surgeons, and Licentiate of the Royal College of Physicians and Surgeons. Now, on return to India, she helped Dr. N.H. Joshee in the identification and care of the victims of plague. In 1897, the plague had just started in Bombay, and Dr. Joshee is one of the great names in the history of the epidemic of plague from 1897 to 1901 or 1902. And of course, Dr. Joshee has been acclaimed for his work. In 1920, Gandhiji wrote in Young India. Of course, he did not write about Manak in reference to medicine, but he said that the ranks of noted families who have taken up to spinning has been joined by Manakji Bahadurji. Dr. Cecilia de Monte also obtained the licentiate degree of licentiate in medicine and surgery in 1897. She's also a graduate of the Grand Medical College. There was only one medical college at that time. And like the two previous ladies we have considered, she too had a brilliant career, winning medals and scholarships and prizes. And then she went to Kama Hospital, where she was a house surgeon in 1898. And 2 years later, she married Dr. D.A. De Monte, who was a distinguished physician of that time in Bandra. She succeeded Annie Walk when Annie Walk died in 1901. She succeeded Annie Walk as the second physician and later became the first physician when Dr. Benson, who was earlier the first physician, went on leave. She retired from Kama after serving it for 32 years and was then appointed onto its advisory board. And she donated funds to create quarters for the house surgeons of the Kama Hospital. And she was the first woman member of the Bombay Medical Council. Others who were appointed at the same time in 1937 were Dr. S.L. Bhatia and Dr. Firoz Barucha. S.L. Bhatia was the principal of the Grand Medical College at that time. And Dr. Firoz Barucha, the father of Dr. Eddie Barucha, whom everybody I think knows, Dr. Firoz Barucha was a very eminent physician and one of the first professors of medicine at the newly founded JS Medical College and KEM Hospital. And so Cecilia de Monte was on the Bombay Medical Council. The Bombay Medical Council incidentally gave birth to the Medical Council of India, which is now based in Delhi, and to the Maharashtra Medical Council, which is of course based in Maharashtra. We now come to Dr. Jerusha Jhirad, a very, very prominent name in the history of medicine in Bombay, particularly when you consider the history of medicine pertaining to women. And I have three photographs which I was fortunate enough to be able to gather. And you see Dr. Jhirad as a student in the Grand Medical College when she was in charge of Kama Hospital and long after she had retired. She chose medicine after seeing her sister's recovery under Dr. Benson's treatment at Kama Hospital. And she entered the Grand Medical College. And like these earlier ladies we talked about, she also had a bank full of scholarships and prizes. She got her LMNS, started general practice in Bombay because the residence post at the JJ Hospital was still not open to women. And then in 1914, she got a Tata loan scholarship to travel to England. And within 6 months, the government of India offered her a scholarship which enabled her to pay off her debt to the Tatas. She worked at the Elizabeth Garrett Anderson in London for 2 years. And on returning to Bombay, she started private practice, was then a surgeon at the Kama Hospital. She was the first Indian to be appointed the first medical officer at Kama Hospital on a permanent basis. The others that we talked to were on a temporary basis. She founded the first hostel for postgraduate students in Bombay. She made Kama a teaching hospital by affiliating it to the Grand Medical College and therefore enhanced its prestige tremendously. She was elected fellow and member of the syndicate of the University of Bombay, a rare distinction. And she was also elected a fellow of the Royal College of Obstetricians and Gynecologists. Again, a rare distinction for that time. In 1947, she was awarded the MBE by the monarch in Britain. Many years later, India decided to honor her with the Padma Shri. Dosibai Dadabai had an even more distinguished academic career. She obtained her LMNS after training in the Grand Medical College in 1903 and then worked with Sir Temulji Nariman and Dr. Masina at the Parsi Lying-in Hospital in Bombay. She wished to advance her academic career and so she went to England where she worked at the Royal Free and at the London School of Medicine for Women. And in 1912, she was the first woman ever from any country, including Britain, to be elected member of the Royal College of Physicians of London. And she was the first Indian woman to be awarded the MD by the University of London. MRCP, a very desired qualification, was given to this lady who was the first woman ever to be given this qualification. And on her return, as most of her predecessors had done, she was the first honorary obstetrician and surgeon at Kama. She was the first woman honorary professor at the newly founded GS Medical College at KEM Hospital. She was in the forefront of the treatment of cancer in women and actually imported radium for this cancer. She was the first Indian woman president of the Association of Medical Women of India. Up to now, it had been British women who had headed this association. And she was the first Indian woman fellow of the Bombay University. In 1945, she was awarded the MBE for her work at the Kama Hospital. If you wish to learn more about her, please look up this tribute to her by Dr. Jhirad, which is listed at the bottom of the slide. Now, in 2018, just 3 years ago, the Royal College of Physicians honored her again. They put up this notice of 500 years of women in medicine. And guess whose photograph they used to illustrate this? It was the photograph of Dr. Dosibai Dadapur, the only women in a group of very senior and sober men. Now we come to the last lady that we are going to discuss today, and that is Dr. Vatsala Samant. She had an extraordinary career, but in a different manner. In 1933, she got her MBBS from the GS Medical College. This is the only lady in this list of 8 who graduated not from the Grand Medical, but from GS Medical College. But she dropped out of college for 1 year to join Gandhiji's Salt Satyagraha. She followed Nehru's message, the message which Nehru had written in her autograph book, live dangerously. And so she was in and out of jail during the freedom movement. Fortunately for her, the dean of the GS Medical College was Dr. Jhirad Mehta. And so he sympathized with her efforts. When my wife interviewed her in Pune in her later years, this is what she said. When I was a girl, there were ideals, honesty, selflessness, and no corruption. Unfortunately, these have now disappeared. Now, Dr. Vatsala Samant had trained in surgery at the KEM hospital under very eminent individuals, Dr. A.V. Baliga, the surgeon, and Dr. N.A. Kurandare, the obstetrician and gynecologist. And then she went on to work at Kama Hospital. In 1942, Jawaharlal Nehru made a request to Dr. Jhirad Mehta. I need a woman doctor to be the superintendent of the Kamala Nehru Hospital in Allahabad. And I want that lady to be the chief obstetrician and gynecologist. Find a lady for me. Now, Nehru and Jhirad Mehta were on first name terms. So when he made this request, Dr. Jhirad Mehta felt obliged to meet that request. And the best person he could think of was Dr. Vatsala Samant. So he requested her. And Dr. Vatsala Samant gave way to this. I mean, she accepted this request, discarding what could have been a very remunerative career as a consultant in Bombay. And she said, yes, I will go and I will serve in Allahabad as you have requested me. So Dr. Jhirad Mehta made her work in every single administrative section in the KEM so that she would be conversant with all the paperwork and the administrative methods and mechanisms. Then she went to Allahabad. And when she had settled in Allahabad at the hospital, Dr. Jhirad Mehta further helped her out by sending Dr. Mrs. Puvaya to serve as her matron. And the two of them raised the standards at the Kamala Nehru Hospital to such a level that even leading families who would never have come to such a hospital now sought treatment over here. And even today, she's a legendary name in Allahabad. We are often asked this question, who was India's first woman doctor? It's a bit difficult to answer. If you talk only about Indian women, then there were two, Anandibai Joshi and Kadambini Ganguly. Anandibai from Philadelphia and Kadambini Ganguly from Calcutta. If you ask about who was the first woman doctor who had studied in India, Dr. Ganguly. If you ask who was the first British woman doctor who studied in India, then we have three who preceded Anandibai and Kadambari by 8 years, because Madras University had started accepting women in their medical colleges much before Bombay. And so in 1878, Charlie, Mitchell, White, and Beale, four of them, had graduated in medicine. And so they were the first Indian British women doctors. And of course, we have Annie Walk, but she was almost 10 years later. So this is the answer to who was India's first women doctor. I'm going to end this talk by a reference to outer space. And it is exhilarating to learn that two of our ladies, whom we have talked about, have been honored in outer space. The International Astronomical Union names craters on Venus. After all, Venus is an eminent lady. So the craters on Venus have been named after women who have made fundamental and outstanding contributions to their fields. Two such craters are named Joshee and Jhirad. And you can see Joshee on the left and Jhirad on your right. So we have had a galaxy of women doctors who have struggled, who have ventured into fields that very few other women dared to venture, and made brilliant successes of their careers. In doing so, they paved the way for their successors who came in as medical students. And it is interesting to note that in many medical colleges in India today, women students outnumber male students in the first MBBS class. I have given you the tales of 8 doctors. These are arbitrary choices. If another expert was talking, that person would probably choose some other people. But I do hope I've given you an inkling of what women from Bombay could do if they were given the chance. And here are 8 sparkling examples. Thank you very much.
Thank you, Dr. Pandya. Thank you so much. That was really, really enlightening. It was, great to see how these women, with real gumption and determination, pursued their dreams, and how they also sort of helped each other and, encouraged more women to take up this medical field. And I especially enjoyed the story of Dr. Edith Piche, about the first hospital completely staffed by women. I had no idea about that. Thank you so much again for putting in time and effort into this presentation. We really enjoyed it.
Thank you. Thank you. Thank you for the invitation.